Hi there, this is Dr. Evan Osar with Integrative Movement Institute. How are you? Happy Tuesday. We have been talking about, if you've been following us, we've been talking about breathing, Anatomy 101 or the anatomy of breathing. Why is this information so important? Well, it can help your clients that have postural issues, right? Because when we think about breath and three-dimensional breath as we discuss it and define it here in our programs, and with our clients, it's about breathing into the cylinder. The cylinder is the thoracolpelvic cylinder from the first rib, which is right behind your collarbones. So stick your fingers on your collarbones or your clavicles, go straight back. That's the top of your ribs, I should say the first rib, and the top of the apex of your lungs, the top of the lungs. That's how high up the lungs comes, right below your fingers, right there. The bottom of the cylinder, if we think about our rib cage as a series of stacked rings, the bottom of our cylinder is the pelvis. The pelvic floor, if you put your hands on your ischial tuberosities, the pelvic floor is right in between. It's the floor of the cylinder. So we want to breathe into the entire cylinder, top to bottom, side to side, as well as front to back. That's three-dimensional breathing. We've also discussed why belly breathing is not optimal breathing. Now, you may say, hey, what singers get trained to do belly breathing? Yes, singers get trained to do belly breathing, and they also know how to and learn how to use their entire thorax, because you can't just belly breathe and sing. You have to expand. They have to expand their entire thorax. So the individuals that come into our office that breathe the best, that we have to do very little with retraining their breath, are people who've been trained as singers. And sometimes they need a little tweaking, but for the most part, they actually know how to use their entire cylinder. So that's how it relates to posture. Let me add one more thing. It's really about like blowing up that stability ball. When you think about the stability ball in the gym, when it's blown up to its full capacity, it doesn't compress or compresses very little. That's the same thing with our cylinder. When we're regulating pressure inside the cylinder, which is what the diaphragm does, it's a pressure regulator. It helps to control the cylinder, the pressure inside the cylinder, and now you're very resistant, your client is very resistant to being compressed. However, what's the posture of many of your clients? It looks like this, yeah? It looks like they're being basically compressed by gravity. Muscle contractions, your muscles contract and pull down and together. And if you don't resist that, you will get compressed. So we need that three-dimensional breathing to withstand gravity and muscle contraction, as well as any external loads, whether we're doing overhead presses, shoulder presses, whether we're doing squatted, barbell squats or deadlifts. We need that internal pressure to counteract external loads as well. So gravity, muscle contraction, as well as external loads. Can it help you improve performance and help your clients improve performance? Absolutely. Because when your clients have a more optimal three-dimensional breathing strategy, they are able to maximize the alignment, the breathing, and ultimately the control they need to then transfer that force, especially that elastic force and that rotary force that's created when we wind up or when we rotate, into power that direction, or power whichever direction they need to, whether they're throwing a ball, whether they're running and or lifting or throwing something. They're able to use that cylinder, their cylinder is basically winding themselves up. But if the cylinder is compressed, now you can't wind up well, and you over shear your body, or over translate your body. Translation and shear are normal forces on the body, but it's when your clients go to rotate and then they have to compress to rotate, or they laterally translate or over shear the joints to create that rotation. That's where our clients get into trouble. So yes, posture, breathing can improve posture, breathing will improve performance as well when you teach your client the right three-dimensional breathing strategy, when you teach them the right progressions. Because one of the things that I've been posting on our Instagram page at IIHFE is some of the progressions of how do you start to train your clients at a higher level. Because yes, it's important to train your clients in static positions, like lying on your back, like standing up, like in quadruped, maybe sideline, maybe in a plank position. It's also important to teach your clients three-dimensional breathing when your client is performing at a high level. Because think about this, if your client tends to have this posture right here, and even that posture right there, some of your athletes, some of your younger people, some of you may have this posture right here, which I can tend to do if I don't pay attention to it. And now you go to perform a heavy exercise, and now you're breathing heavy. You're just breathing and reinforcing that posture, that thoracolumbar hinge, that chest chest-specific breathing or that chest biased breathing or that belly biased breathing, and you're not able to get that breath into the back. So we want to make sure that we're reinforcing three-dimensional breathing even at those higher levels. So I shared a couple examples of that on my Instagram page, on our Instagram page, in this week's few posts that I've made so far. So check that out. Now, this here is a picture that Janice drew for our last week's episode of Two Anatomy Geeks. It actually shows a couple of muscles that aid in respiration. So we'll finish up talking about this. So if you think about your, sort of like we're looking at the spine from somebody from behind. Now this is the iliac crest. So if you put your fingers on your iliac crest right here, and then you stick your thumb right up in there, so right back in there, that's your quadratus lumborum. You can see how the quadratus lumborum goes this direction. Quadratus just means four sides, and it's basically four sides of that muscle. It attaches from the iliac crest into the lowest rib, and it also attaches into the lumbar vertebrae. So it's a very important stabilizer of the lower rib cage, as well as the pelvis and the lumbar spine. Your serratus, these little red dots, is a serratus posterior inferior. Both these muscles have important roles in helping to maintain that cylinder. Serratus posterior inferior actually helps to pull those ribs down to aid in inspiration and or expiration, depending on what you're doing and how fast you're breathing. But again, two important muscles. If we think about a lot of our clients, they may be side bent. So when they're walking, for example, some of our older clients, when they're walking and they start to step onto that same side leg, so as they step on their left leg, they may side bend and into that side. They may shorten that QL. They generally are not breathing into that side. That will generally cause them to use more effort when they get onto that left leg into single leg stance, because they're not able to lengthen and stay on top or keep their cylinder aligned over top of their leg. So one of the things you can look at when we talk about performance is look at how your clients are walking. Are they walking with nice uprightness, nice cylinder control? Do they have that counter rotation, or are they doing that sort of weeble wobble walk, as we call it, weeble wobble, because it looks like a weeble wobble. They kind of walk like this, and maybe just list to one side, or they may list to both sides, depending on how much they're compensating for the lack of that cylinder control. And lastly, about performance, I'm doing a module for the master's program, the online master's program that I'm teaching with my good buddy, Dr. Darren Smith. And this week's lab that I'm recording has to do with knee injuries. So how does breathing lead to knee injuries? Well, there's a study that came out back in, I believe it was 2007, where they looked at athletes. They took a group of, I think it was 277 athletes. They looked at them before the season. So they took males and females, about equal amounts, but I think it was a few more males. They looked at their ability to, they'd go in single leg stance, they put a force on them, and they let the force go and see how much their trunk sort of moved once the force was removed. And then they let them do their season. And then they looked at how many athletes actually created, or had, I should say, had ACL tears. And what they found was the athletes that had the ACL tears were the athletes that also, in this test, they had a bigger lateral displacement of their ribcage on that preseason test. So what they concluded was your core, deficits in your core alignment and control, and I will relate it back to breathing, how well you're breathing, how well you're aligning, breathing, and controlling your cylinder will also determine, as the study proved, will determine if you are going to potentially create a lower extremity injury like an ACL tear. So that's why breathing and how breathing can relate to lower extremity function, posture, performance, and whether your clients and your athletes are performing at their greatest level. So I hope that made sense. There's a lot of information. The muscles, some of the muscles that we talk about that are involved with respiration, when we think about it, all the muscles around the trunk and spine are related to breathing in some levels. Some are just more primary, some are secondary, but all the muscles in the trunk are important in relationship to breathing. So the more optimal three-dimensional breathing is, the more optimal these muscles can function, the more optimal alignment, posture, and movement, and ultimately performance is. So I hope you enjoyed this segment of Two Anatomy, I should say, of Integrated Movement Insider. In this series of Two Anatomy Geeks, we are covering the anatomy of breathing, Breathing 101, and we go deep into how you not only assess breathing, I should say not only how do these muscles work, we talk about muscles. This week we're talking about the accessory muscles, the SCM and pectoralis minor, and how these muscles can become overactive when your client does not have a good three-dimensional breathing strategy, and they become over neck breathers and over chest breathers, and they start to change their posture. This posture is really just a posture to make the accessory muscles like your SCM and your pec minor more efficient at breathing. So the more that your clients are in this posture, the more they're going to stay in this posture and overuse those accessory muscles. So we want to help our clients get into a more optimal position. We want to teach them a more optimal three-dimensional breathing strategy, and that way they can start to let some of these other muscles relax and not work so hard. So we're going to discuss those muscles, and we'll also look at some of the assessments and how do you take this information and put it into the upright position and into some functional exercise patterns. So we've taught you already how to do three-dimensional breathing on the ground in a static position. Now we want to take and progress that into the upright position in more dynamic exercises and activities. So Mary's going to put the link next to this video wherever you're watching it, so you can get access to this 3-part series, 3 modules over it's about 5 to 6 hours of information, plus the handouts, plus the question and answer. We answered some of the most common questions of breathing and why we do breathing the way we do, the importance of nasal breathing, the importance of not over breathing, and especially what mouth breathing does to us, and why breathing off too much carbon dioxide is actually a problem, and not why not nose breathing is a problem. So we cover it all in this series. So check out Two Anatomy Geeks, the anatomy of breathing. It's really one of the best, simplest, maybe the best, in my humble opinion, and the simplest way to understand breathing. And like Christoph said to us last week, he sent us a testimonial. It wasn't even a testimonial, it was just he was sending us a question, and he's like, wow, it's really cool. It's like having Dr. Osar and Jill with you on a Saturday morning. It's like having your big brother and big sister helping you with your anatomy homework and being there right by your side. So it's really an amazing community. And Jill and I love doing this. We love being part of Two Anatomy Geeks, and love all of you that are part of our community. So check it out. If you're not part of it and you want to learn more about the anatomy of breathing, we'd love to have you. We'd love to have you join us. The link will be somewhere here next to this video. We look forward to seeing you this Saturday and or in the recordings. So have a great day. Get out there. Again, be the force. Be that leader that helps to bring people together, to unite them, and create a positive environment for your clients. Thanks for all you do. This is Dr. Osar with the Integrative Movement Institute. We'll catch you next time. Make it a great day.